Dr. Auerbach, I want to talk a topic which is, to me, one of the most interesting and important topics, not just in dentistry, but in health period, I think. But I may be very wrong here. Let's talk periodontal disease, gum disease. Every dentist, when he tells you that you have periodontal disease, he kind of keeps saying in the same sentence, you got to fix it because otherwise you lose your teeth. Now, that may be 2 years, that may be 10 years down the road, but somewhere in that level you start, more or less losing those things. Now, while this is pretty bad, no doubt about it, here's one thing about losing your teeth. You dentists became very, very good putting implants in it, even dentures, which are implant supported and quite cheap than lots of implants and cheaper and yet quite good and all that stuff. And anyway, you guys are good. It's not anymore like George Washington, who apparently ran around with a wooden tooth. That must have been awful. But so the stuff is pretty good. Maybe a little bit expensive, but pretty good. However, it's what happens in between which concerns me, because the mouth is the gateway of your blood vessels. And when you have a gum disease, you basically have an infection. You have that yellow, reddish, ugly pus, which is sitting in there all over the mouth. And it gets mixed up with your food, goes down to your stomach and goes from there everywhere. And of course, it goes straight into the blood at your gums. And it ruins your liver, it ruins your kidney. We know it's linked to heart disease, build-up of blood. It's linked to strokes, linked to lower immune system. They say that ladies who have gum disease and are pregnant will risk to have a premature birth and an underweight baby. Looks to me that all that stuff is much more devastating than losing the teeth, especially in a time where you can put them in with a little bit of money, no big deal. You tell me how wrong I am here.
No, I think you've covered pretty much all of the points there. That's true. Keeping the gums healthy is very important because any infection in your mouth spreads to your entire body and can cause infections anywhere else.
So, and those other infections, like the kidney, basically the blood gets infected and everything the blood touches, which is everything, can then possibly create an illness. So now again, you have liver, you have kidney, you have premature baby, you have a lowered immune system, so you get easier at the flu season. Never mind the bird flu, the swine flu, just the normal flu season. And work suffers. You're more fatigued, more tired and all that. Are those all symptoms which, yes, gum disease will bring about or can bring about or not?
I believe so. When your body has an infection, wherever it is in your body is fighting it. So that's using its energy and resources to do something that energy could be used for something else, be it sports performance or just keeping healthy.
Right.
So you want to keep your mouth healthy.
Yeah, or just thinking straight in your everyday working activity, being more alert, whether that is solving problem or having new ideas.
Right.
Is it true that many surgeons, the guys who do the hip operation and for which they use the same material than you dentists, titanium, right?
Right.
For the implant. So anyway, the guys who do that, the knee operation, the guys who do the appendix and the tonsils and all that type of stuff, those type of surgeons, is it true that lately, the last few years only, more and more, they demand a clean bill of oral health? And by that, they're not worried about having crooked teeth and needing orthodontic work. They're not worried even about cavities all that much. They're just worried about gum disease. They want a dentist like you, give a certificate and say, this guy has a clean, does not have gum disease. Because if they do, they have noticed that their operation at the point of operation might fail because the infection which went into the blood may make the operation fail, or that the body is overall so weakened that the additional stress of a new operation isn't good. Because we know that no guy will take appendix out or do a hip operation while you have a bronchitis nicely in the coot. They won't do it because you have too much infection going on. So they start now realizing that this gum disease is at the same level than a bronchitis or any other illness you might have, and you need to first get rid of it. Have you noticed that trend happening more and more yourself?
I have, Helmut, and it started, many years ago with transplant patients. They needed to get a clean bill of health to be able to have the transplants not become compromised because of the immune system working on the mouth infection. So now that has translated over to other operations, and especially any heart valves or any knee replacements or hips, because that bacteria in the bloodstream going to that site can cause those issues to fail.
So do you think that having overall throughout life a good gum, having no periodontal disease or at least very little, it always gets fixed and stuff like that, contributes to a longer, more vigorant life?
I do. I'm not aware of any studies that have shown that, but I do believe that personally.
Do you see patients, do you see older patients, do you yourself can observe, not necessarily just anecdote, not necessarily a scientific study, but do you yourself in your office observe people with bad mouths for a long time, looking older, feeling older, being more sick, versus people with good mouths all the time for some reason having a more other healthy existence? Just from your feeling. We're not trying to put this in a scientific study here.
Sure, absolutely, Helmut. The patients, no matter what their age, if their mouth is healthy, they just look more vibrant and healthy. They seem to be happier, and they just are more full of life. And the patients who have the gum disease tend to just look older and more slow, not quite as happy, stuff like that. I can kind of see that.
Look older. Well, so maybe we should interrupt this broadcast for a special emergency visit from me to my dentist to see whether I'm okay with my mouth. Because I don't want to look older than I am already. Thank you very much for this insight here, Dr. Auerbach.
My pleasure.